really don't know how to begin, but didn't come here to speak. Kind of wing it. 2002, I joined the military, and in 2004, I was injured very severely and had to have my spinal fused together. I would take 12 different medications while I was listed. 8 of those would all be narcotics, from morphine sulfates, Valium, hydrocodone, and the list kind of keeps going on, Neurontin, and stuff like that, to control the after effects and pain from my surgery, my fusion and whatnot. And they finally retired me. I'm on what's called the TRL, temporary disabled retirement list. And in September 7th actually, that'll be my 5-year marker on TRL, and then they'll transfer me to permanent retirement because of injuries and stuff that I sustained while on active duty. And when I was retired, I kept my military benefits there, my insurance and whatnot, and that has been what has helped me out here from my retirement up till today. I see the doctor quite often for my spinal problems and whatnot, and nerve damage I have inside my leg, and all the stuff that's transpired afterwards. The guy that you see before you today used to weigh 170 pounds. He's a 300-pound man now. So I've doubled in size, and I'm lucky that I can still walk now. After I came out of the surgery, I had to relearn how to walk, clothe myself, and go to the bathroom if you want to talk about that. But it changed me. Before my injury, I never took any narcotic medications there for pain control and whatnot. The most potent you would get me would be Tylenol or aspirin. But I take these medications to normal, if you will, instead of concentrating very hard on pain control so that I don't feel it as often. These medications help to numb it away, but from such long-term usage, I take fentanyl. Most of you have heard about it, like the news, they're being recalled, but it's a patch that you put on your skin, and it transfers your narcotics directly through the skin. There's this way you don't have to take pills all the time. When you've started to feel the pain's already there. You're just trying to combat it, but at least with this transdermal type system, I don't have to worry about it for 3 days usage and stuff. But one day, once 5 years after my fusion and whatnot, I was in discussions with my pain specialist at Mary Greeley Medical Center there, and I wanted to know what are going to be the long terms of me taking this, because I'm going to take pain medication for the rest of my life. That's just something I'm going to have to live with, be it opiates and muscle relaxers and stuff like that to control the pain, or be it something like medical marijuana that's a natural type. It grows naturally. What would be the best for taking care of the pain? And I asked him because I'm starting to pass proteins inside the kids. When I go to the restroom and stuff, I did urinalysis and I started to pass proteins. And there was a sign that my kidneys and liver were all wavering inside there of not wanting to work anymore because of all the drugs that have been pushed through here. And he didn't know the answer to that question of what's going to happen in the long term. I mean, I'm 31 years old now. When I was disabled and I was 25, 26. So I've been taking the narcotics since then, regular and daily. And I asked him what he would do. And if this was California, he would just get prescribed medical marijuana. But it's not. And we work with what pain medications that I have. right now and do the increases in dosages as things have permitted, like my dirties or the fentanyl patch that I just showed. We just upped that from 75 to 100 micrograms just within the last month. And it's just because I'm getting used to the drugs I'm taking now, and they're opiates. And I'm sure we're just going to keep increasing. But if there's something natural that's out there that, one, don't have to worry about there being a hole inside the patch and having it pulled on a fold and stuff there, and you could die because you put on your medications, or like when you sit inside of a hot tub, to relieve the muscles inside my back there, to relieve that tightening there, so this way that you don't have. One thing I didn't know about wearing a dirty you sit inside a hot tub because it pumps the medication directly into you right away because you're sweating. But if there's something natural out there, and it could be tested, and so forth, they could be legalized and either be in food form or smoke form or whatnot, I'd like to try it and see if that will take 5 or 6 different narcotic medications right now, instead of the 11 I was taking before. But if I could take one substance that would alleviate 5 different pills that I could take, I would very much appreciate that and love to try it. Before my injury, I would have been one of the most stark people against marijuana legalization, but I've seen both sides of it. Now that I've been injured and know what it's like to be in pain daily, and know that this is probably shortening my life on taking all the opiates that I'm taking right now. I mean, I don't know what the outcome is for lengthy long term, but having to take them from age 25 on, I'm pretty sure that shortens up the lifespan just a little bit. So I thank you guys for listening to me, and hopefully you guys can do a good.